Hey, it's Bob Butera with Comprehensive Yoga Therapy at the Yoga Life Institute. I'd like to take a longer look now at this point that I've been talking a lot about lately, which is yoga therapy and a condition, as opposed to yoga therapy for a condition. You see, the word and the word for are conjunctions grammatically. They connect different thoughts, they connect different ideas. So if you think of how and connects something, it adds something to it. You have this hand, and now we've got two. So when we think of yoga therapy and you with your condition, we make more. However, if we think yoga therapy for your condition, then yoga therapy comes over and takes care of your condition. But in the real world, that doesn't work with something that's participatory, with something that you can do on your own to keep your health strong. When we think of modern medicine, we want to use modern medicine for your diabetes. It's miraculous what we can do. Modern medicine can help us. Medicines, certain interventions can truly help us. It's just when we need the extreme help, like a diabetic needs insulin, an asthmatic has an inhaler that helps open the airway passages, somebody with heart disease can take medications to help with blood pressure. It's huge. With depression or anxiety, we can give ourselves a hand. However, that's not going to work over the long haul. We have to participate with that. So things, holistic sciences like yoga therapy, then do the and approach where we couple with modern medicine, we complement it, and we maximize what we can do on our own to stabilize our blood pressure, to keep our airways open, our lungs strong. We keep our blood sugar healthy, we keep our fitness strong. We have back pain, we become self-aware of our posture, we become self-aware of our attitude and how we're using our body, we exercise more, we do a lot of yoga stretches, and then we work the and method. So the for is when we're thinking of being helped by the healer, and the and is when we're participating in this activity and then following the healer's instructions or doing something like yoga therapy. That's what it's all about. It's all about helping you understand where you're weak and what you need, and then we can instill practices so that you strengthen yourself. One of the reasons our yoga therapy sessions are so effective for people is because the session is really usually times 7 if it's once a week, because you went home and did 7 days of homework. If it's twice a week, it's times 14 days. So when I meet with somebody and they actually go home and do their relaxation exercise or their meditation or a series of poses that are really yoga poses that are really helpful to them, they come back feeling 100 times better and they're ready for the next step. So again, think of and when you think of taking care of yourself, because you're a key component of that, obviously. So we're going to stay with yoga therapy and we're going to help healers do things for us, which are very supportive. And then when we have both, we have a really good team. All the best.